think that's very eye-opening, isn't it? And our last video segment will be about the accountable care organizations. So,
Accountable care organization, and there are several versions of them out there that they're talking about proposing through the healthcare law. But essentially, it's kind of what we call an HMO on steroids. It's you're grouping together the hospital, doctors, all the providers into a big lump, and they're going to get one payment, say, for a hip replacement. So for a hip replacement, you get paid X amount of dollars, and all that money is going to trickle down through everybody into the hospital, or somebody will decide who gets paid how much. That's how they're going to control costs. Then they might get bonuses if they don't spend all that money. Well, how would they maybe not spend that money? They might spend that money by not treating people quite as much as they would have if this went in place. Or maybe they're not going to do a couple of extra lab tests that they might really want to do to make sure they have the right diagnosis. In other words, there's going to be an incentive for providers not to give care, not to do diagnostic tests, because they're going to get paid more if they don't do it. As a patient and as a physician, I just find that warped. That is not the right way to decrease costs. In addition, this accountable care organization will focus all of the medical care on hospitals. Well, the hospitals love that. That's why they liked PPACA. They signed on to this a long time ago, because it brings all of the patient care under their jurisdiction, so to speak. So instead of having all of these outlying outpatient centers for imaging or surgery centers or things like that that charge a whole lot less than the hospitals, now the hospitals will have control over the patients. So it's going to be the end of private practice. Already, half of the doctors in this country are not in private practice. They're employed by Kaiser or a hospital directly. So it's going to be the end of private practice, and it could be the end of these competitive outpatient facilities that can give care, excellent care, at a much lower price. Electronic health records. Bottom line, do you really want the government in charge of your health care records or your health care? But they're also going to have access to your personal medical records. So right now, doctors are supposed to set up a system that is approved by the federal government. There are all kinds of systems out there for electronic health records. And they sold this, and it does sound like a great idea. Let's have, if I'm here in Colorado, but I go traveling to Florida, and I get sick in Florida, wouldn't it be great for Florida to be able to contact Colorado anytime, day or night, access my electronic health records, and see what medications I'm on, what health problems I have, blah, blah, blah. That makes all kinds of sense, doesn't it? I think it's a great idea. The logistics of it are not quite working out that way. So, right now it's costing between $35,000 and $50,000 per physician to set up these systems. And then there's ongoing maintenance fees and payments that go for $300 to $1,500 a month. And then we have this meaningful use where you have to check off all this mountain of information every time you see a patient that's essentially just useless information. You come in with a rash, and they have to check ears, eyes, nose, and they listen to the heart and lungs and all this stuff that's totally unnecessary. But in order to get paid, in order to jump through the hoops of the federal government, doctors have to spend time doing this. It's a waste of physician time. It's time away from the patient. They would much rather be at the bedside than sitting at a computer. When the government has access to your personal medical records, let's talk about what that may mean. Are you as likely to talk to your physician about sexual dysfunction? Whether you've had an abortion? Whether you have drug or alcohol dependency? Whether you're depressed or have an anxiety disorder? I think that this alone threatens the doctor-patient relationship. Are you really going to tell your doctor everything that's going on with you like you feel comfortable doing now? Another thing that physicians are going to have to worry about is the expansion of Medicare fraud charges. So, according to this law, a person need not have actual knowledge nor specific intent to violate the healthcare law in order to commit healthcare fraud. So you don't have to know that you're doing it. You don't even have to know that there's a rule that says you can't do it. Intent is assumed. So, when Medicare passed as a law, there were 1,000 pages of rules and regulation for every 1 page of legislation in the Medicare law. The PPACA law has over 2,800 pages of legislation. And if you apply the same calculations, that would be 2.8 million pages of regulation. I put 1 million pages here because I thought it was kind of overwhelming. I put the whole amount. But probably 1 million pages of regulation, and we're supposed to know every word that's in it so that we know what to abide by. And if we can't do that or don't know how to interpret a rule or a regulation, we can be charged with fraud. There's actually not a single physician in the entire country who could not be charged with fraud. Period. Do you do everything your doctor tells you to do? I don't do what my doctor tells me to do. So, this law authorizes the Secretary of Health and Human Services, again, a lawyer, to adjust reimbursements to providers based on what they call quality measures. In other words, if you, as my patient, don't do what I tell you to do, and you don't get better, or maybe you get worse, and you come back to me, I won't get paid for that visit. If you're not better, I may not get paid. If that happens to a lot of my patients, then I might get kicked out of the system altogether. If I don't abide by their guidelines, I may not be allowed to play in their system as a physician. So, the interesting thing is that in none of these quality measures is patient compliance taken into consideration. So, they don't care that you didn't do what I told you to do or recommended that you do. All they know is that I must be a bad physician because you didn't do it.
I think Dr. Jill gave you a lot of information on things that you may not know are in your future if we continue under the PPACA law. If you have any questions, right now I know probably a lot of you understand that there'll be more increased enrollment in Medicare, and doctors are going to continue getting paid less and less. There is something called the Sustainable Growth Rate, or the doctor fix, which was a provision to the PPACA law to offset the costs, and it means that Medicare payments to physicians can be cut by 27%, or $19.8 billion in January of 2013, unless congressional action is taken. And we know that, Congress really doesn't take a lot of action real fast these days. So the chances of healthcare being rationed just by the absolute numbers of it, the fact that 35,000 physicians are retiring each year, up to this time, and only 25,000 physicians are graduating to take their places, and many more physicians will probably leave the practice because of these laws and regulations. Medicare doesn't cover the costs to the doctors right now as it is. They take a loss on every Medicare patient. So if the government, through this plan, decreases their payments again, they will take larger losses and probably will not take those patients. So just by the fact that there's more patients and not enough doctors, there'll be healthcare rationing. For instance, we did mention that the taxpayers are paying for everything. The federal government, the state governments, who are now called upon to do all of these things. And they're going to provide these services. Well, remember that they don't have any money to provide them. All the money comes from you. Even if you don't pay federal income taxes, you'll see the prices of everything going up because everyone will pass the costs along. So your costs of goods and services will increase. There's no denying that. PPACA is going to create 159 new bureaucracies, 47 new agencies, boards, and commissions, 68 new grant programs, 16,500 new IRS agents, and 20 new taxes. How can we work on this? How can this be good for our country? I think Martha Dean was telling you what some alternatives are, what maybe can be done. But I want you to know that this is in this law. A lot of things we haven't even spoken about tonight are in the law. I want to open it up now to our experts on our panels to make comments. Tell us about how this new law is related to your line of work. So, who would like to go first? Will Connor.